topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Texas. Welcome to another Ask the Expert show where for the last 16 years, going on 17 next month, we have brought you the top experts in the field of legal, health, financial, and home improvement. Our show for the next 25 minutes is very special to me. It's special to me because I had to learn about Medicare the hard way. There are so many things that you need to know that these national commercials don't teach you. And I'm going to tell you today how important it is to have a good agent, because I went through all this and I'm just so happy that we found the Belvin Insurance Agency with Jill Belvin. Good morning, Jill.
Good morning, Steve. How are you?
I'm fine. Listen, we got 2 more days of Thanksgiving, but most important, God, there's so much to know about open enrollment, what's going on with Medicare. I have to ask you this. We have a lot of questions, people wanting to know, do you also handle health insurance?
For under 65, I don't personally handle that, but I do have an associate that I work with. Her name is Stacy Holland, and she does handle that. So if anyone is in need of...
So you're just Medicare.
I am specifically Medicare. You can only wear so many hats and be good at it. So
right.
Under the health insurance under 65 is a completely different entity.
So Jill, tell us about your agency.
So the Belvin Insurance Agency, I've been a licensed agent for 30 plus years, and it's my passion to help people with their Medicare. I didn't start off doing that 30 years ago, but I got here, and that's what's important. I've had a little bit of experience in a lot of insurance, property, casualty, commercial, general liability, workers' comp, you name it. But over the past 7 years, I have focused my attention on Medicare. It is a significant need in the communities. It's a significant need for folks who are going on Medicare to understand it. And I find just great satisfaction in getting people educated so that they can make their best decision about their Medicare plan. It's a very important decision. They need to know their options. So that's what I do, and I love it.
Jill, I got to tell you that not knowing anything about Medicare, I actually had a friend of mine say, "Are you on Medicare?" And I went, "No." And I just turned 65. And he said, "You got to be on Medicare." And because I was uninformed, that's why the show is so important. I lost a whole year, and it was costly to me. And I don't want this to happen to somebody else. And one other thing, Jill, it is so important who your agent is. That's why I'm so glad that we have you, because I had the worst agent. I didn't know at the time. So I found out they offered me one plan. They didn't offer me additional plans. And it was like they were just an order taker. You don't handle your business that way, do you?
No, absolutely not. I'm actually appointed with 17 different companies and over 150 plans. So I, educate, assess the needs of a client, find out what direction, what they're comfortable with, what their risk factors are, what their health issues are. We talk about everything. And then we determine, they determine really what's going to work the best for them. I mean, of course, I give my inputs as far as what's available and what the options are, but they get to make their best decision because they're in the know. Basically, after I talk to them and explain, they are educated consumers at that point, so they get to choose their plan and get to choose what options they want to have. So it's important to be knowledgeable so you can make the right choices. That's what I do.
So let's talk open enrollment. That's what you're going through right now.
Actually,
And
we're going through
really,
annual. So we're in annual enrollment right now.
annual.
Annual. So that's kind of what I want
And
to talk
people
about.
don't understand what that is.
Okay, so there's differences between annual and open enrollment. So, and most people don't understand it. The annual enrollment period is the one we're in currently. We have 13 days left, counting down. Annual enrollment is not just for Medicare Advantage beneficiaries. The annual enrollment is for people on Medicare Advantage, people who have a standalone prescription drug plan, and just really anyone who has Medicare, because during the annual enrollment, you also are allowed, if you're eligible, to go from either a traditional Medicare, well, that you're eligible for that anytime, traditional Medicare to a Medicare Advantage, or if you are eligible or qualify, you can go from Medicare Advantage to original Medicare at that point and add a supplemental. So it's a very wide range of things you can do during annual enrollment. Okay. And that is, like I said, October 15th through December 7th. The open enrollment period, which starts January the 1st and goes through March 31st, is prohibited. It's more compact. It's only Medicare Advantage plan beneficiaries. So it allows a Medicare Advantage, person who has a Medicare Advantage plan, to switch their Medicare Advantage plan to a different plan with Medicare Advantage only. So it's more limited. Annual enrollment, more open. Anyone on Medicare, it could be a prescription plan, could be a Medicare Advantage plan, could be original Medicare, and they could switch, back and forth, or to one or the other, original Medicare Advantage original. The open enrollment, only Medicare Advantage plan switches during that period of time. That's January through March. So different.
That's one I'm on right now.
Yeah.
So that's why I said, Jill, there's so many people who don't understand, there's A, B, C, D. In fact, most of the questions here, people wondering if you will explain those to people.
Yeah. So part A is what I explain it like this. There's a foundation to your Medicare, and it's called traditional Medicare. That is what the government provides to you, not free of charge, but they provide it. Part A is a portion of that. It's hospital coverage. Part B is your doctor and your outpatient coverage. Typically, Part A is free of charge if you've worked your 40 quarters. Your Part B is going to have a premium associated with it that Social Security and Medicare charge you. The premium for that is going up next year to $206. I think it's 50 cents. This year it was $185. So it's going up in 2026 to $206.50. But that is also a portion of your traditional Medicare. Okay. Once you have your traditional Medicare in place, you have options to supplement it. You do want to supplement that because they only pay 80% of hospital and doctor or major medical with Part A and B. you would be responsible for that additional 20%, and there's no max out of pocket. So you definitely want to choose a way to supplement that. And that's where the other types of insurance come in, like Medicare Advantage Part C is one of those you can use to supplement. That's your Medicare Advantage plans. If you don't do Medicare Advantage Part C, there's another way that you can supplement the plan. It's a Medigap plan, which that's a lot of, there's a lot of different types of Medigaps, just a different method. The best way to explain those methods of doing your supplement or taking away that extra cost that you might be responsible for is going to be, if you do the supplemental plan, the Medigap, your A and B will remain your primary coverage, and that supplemental comes in and pays the additional 20%. And you also have to have that Part D, which they ask about, which is prescription coverage. That's a standalone prescription plan. Okay. If you opt into Medicare Advantage Part C, you don't have to do Part D because Medicare Advantage will include your prescription plan. But if you do opt into that method, you would be losing A and B as primary, because your Medicare Advantage plan will become your primary coverage and be your major source of paying your medical needs and your prescription needs. So there's a lot of alphabet.
Yeah.
Here.
What happens? Here's the bad part now.
Mm-hmm.
What happens if I miss the initial enrollment period?
Mm-hmm. If you miss your initial enrollment period, you're kind of going to have a penalty to pay, as you found out, Steve.
Yes.
So, yes, if you don't enroll in Medicare when you are supposed to enroll in Medicare, and when I say when you're supposed to enroll, your initial enrollment period can be different for every person. So some it's when you turn 65. Others, it's when you leave your creditable group workplace plan. Because if you're working for a large corporation and you have a group workplace plan and that corporation has 20 or more employees or more than 20 employees, you're going to be considered to have creditable coverage. That just means that it's as good as Medicare's, and they won't require you to join Medicare at that time. So you get a reprieve and you can join it later when you're ready to leave that group workplace. But if you don't have that, if you don't have that type of plan, you've got to join in when you're 65. It is essential. Or you incur those late enrollment penalties for the rest of your life. You never can get around those. And the penalty applies to your Part B, which is the doctor and outpatient. And it applies to Part D, which is your prescription drug coverage. So you have penalties for both of those that you can incur if you don't sign up at the right time. Just need to be careful of that.
In Texas, is it broken down to by the county you live in?
Yes, it usually is by county. Yeah. So when you're looking at Medicare Advantage plans, or is that what you're referring to? Or are you talking about?
Well, you know what? I'm actually referring to all these national commercials that make all these promises, and then people find out that that's not even available in their area.
Well, what basically those promises that are made on those commercials are, that there has to be certain items in place to get those things they promise.
Yes.
And those items have to all line up. And if they're not there, then you're not going to have that. And typically what they, advertise out there is additional grocery benefits or utility benefits, things like that. And really, in most cases, in order to have that, you really need to be eligible for Medicaid in order to get that in many cases. Or there is some cases where if you have a chronic condition, diabetes, heart disease, things like that, that you may be able to get some type of benefits, that are additional. But typically, I mean, I have calls about that all the time from existing clientele, just, people calling me, asking me, I've got this ad or I saw this.
Yes.
Can I get this? Well, do you qualify for Medicaid? Well, no. I don't qualify for that. I don't have a disability, or I have too much assets or income, or I own
Right.
a home or a car. Then you won't qualify for those things. I hate to tell you that, because I know it sounds wonderful to get that. I mean,
Yeah.
who wouldn't want it? You know, my husband asks me about it. He's like, these people are calling me. Can I get it, Jill? I'm like, no, you can't get that. And I'll stop. It's funny. Yeah.
So, Jill, you know what else? We're getting a lot of people telling us they're getting so many of these robocalls uh,
Yes.
about
It's awful.
Medicare. And explain to people, because you've been doing this long enough to know the
Hmm.
difference in those robocalls, working with someone like that versus having an agent like yourself.
If you fall for the robocalls, I will say, you're going to have someone really push you into doing something that maybe is not the right choice for you. Unfortunately, it's very unfortunate that those call centers exist and that they're allowed to operate. Honestly, I know that the Centers for Medicare Services have tried to implement certain rules to prevent them from doing these things. They have, asked us to, as agents and professionals, to get permission to contact forms. They're called appointment forms from every potential client that wants to speak to us. It's really just a matter of the client saying, it's okay for you to contact me. It's okay. I want to talk to you about these plans. But you can just really end up in a pickle with talking to these robo callers or these call centers. I've got personal experience with my own customers who have, thought that they heard something good when these
Yes.
people have called them, and they have made changes that messed them up royally. Um, I could give you personal examples, but we won't go into a lot of detail there. But and then I've had to jump through hoops to get them straightened back out. Sometimes
Right.
even contacting Medicare themselves and having Medicare redo their policies, my customers' policies for me, because the only person who can use a special enrollment period of fraudulent causes is Medicare. And I've had to call them and have them re-enroll some of my people into their original plans so that they cannot be losing their benefits, basically, or their doctors, or everything really. It's a mess out there. So just, you got to be very, very wary of the call centers. And they may not be licensed with 17 companies, and I guarantee you that they're not going to try to educate you on what the
Right.
options are, because they're calling and they want to get you on the phone and they want to push you into doing something as quickly as they can so they can move on to the next call. And it's a sad situation, really.
What about a person who's working? Uh, do they have to take Medicare even if they have health insurance through their job?
Depends on the size of their company and whether Medicare, deems it to be creditable insurance. Like I mentioned, if it's above 20 employees, it's going to usually be creditable, which means it's as good as Medicare's coverage, and they don't have to in that event. If it's under 20 employees, then Medicare is not going to see that coverage as creditable. So yes, they will have to take the Medicare at age 65.
Now, when they sign up with you, how long does it take it to go into effect?
If a client needs a policy in effect, like, let's just, in normal circumstances, not annual enrollment, but if they need a policy, if they're doing their initial enrollment and they need a policy to take effect on let's see, we're in November, December 1st. You just have to sign up by the last day of November in order to make it effective December 1st. Unless it is going to be an underwritten product, which would be a Medicare supplemental type product, Medigap plan, and you're going through an underwriting process, but you wouldn't do that on initial enrollment. That would be like a re-qualifying event. Initial enrollment is an automatic issue, and even in a Medicare supplement. But you just have to do it by the end of that month for it to be effective the first of the next month. So it doesn't
Jill,
take a lot of time.
You are such a good speaker on this. I'm so
Thank you.
glad that we have you. I wanted to save the last few minutes. We have all these people who are watching or listening right
Right.
now. Tell them why they should sign up with you.
Well, you should sign up with me
And you can brag.
Well, I mean, I am good at what I do. I really am, and I really do care about my clients, and I really am able to educate you with. I have a process when we go through with initial enrollment, explaining Medicare, the traditional, the foundation, and the two options you have to supplement that. There's only two. I have a very clear and concise way of covering that really opens the eyes, I guess, or makes it very easily understandable. You know, sometimes when you start looking at Medicare options, you get very confused. Oh, I don't know what to do. You know, there's this, there's that, there's so many plans. I have a very concise and educational way of sharing that information with my prospects and my initial enrollees, that by the time we're done discussing it, they're like, I get it now. I only have two options, and this is my two options. Now I just need to figure out which one works best for me. I just think I'm really good at educating, and I do really care about my customers, and
It's obvious.
I'm always going to be there to help them, to answer their questions, you know, to review their plans. It's not just a one and done situation. You don't just write a client or enroll them in a plan and then go about your merry way and forget, you know, to talk to them again or never speak to them again. It is a ongoing relationship where you are always keeping up with their health. If there's any changes, there may need to be readjustments in their plans. And I deal with that on a daily basis. I have clients call me and say, I have this health issue that's come up. Do you think I need to review my plan and see about something different in one of the enrollment periods? I tell them, yes, we need to look at this. We need to see what treatment plan you're going to be on for this situation. And we need to assess it and see what medications may be new to you, look at plans and see if your plan is still a great fit, or do we need to readjust, adjust it to fit this situation you're in. So I'm always going to be there.
Jill, do you worry about, because I keep hearing about companies are pulling out of markets. What
They are.
happens if a company pulls out of your market?
Uh-huh.
I mean, do you have to go find another company?
So a big player did pull out here this year. And what I do is I just get with my clients who are, you know, part of that plan and get them into, you know, shop and talk and educate on other plans and get them enrolled into a new plan. It also brings me I don't know how to describe this, a mountain of opportunities, because I've gotten so many referrals from people who said, my friend is losing their plan and they need help, Jill, and I'm going to give them your number. So I have brought on a ton of new clients because of plans leaving. So it is a disruption, but it's also an opportunity to help people.
Yes. So tell people how they can reach you.
You can call me, 832-281-4474. You can text me on that number as well. You can email me, Jill, Jill, loves Medicare @gmail.com. I have a website you can go to and fill out a contact form. It is www.insurewithbelvin.com. I would be happy to meet with you, educate you, and help you.
And if you've got a relative or a friend that's in San Antonio, El Paso, it doesn't matter. Jill can help you no matter where you're located in Texas.
Mm-hmm.
And she's just the best at what she does. Hey, Jill, have a wonderful Thanksgiving.
Thank you.
Jill,
everybody have a wonderful Thanksgiving. You too,
Jill
Steve.
Be back with us again next month. And we are so blessed to have you, Jill.
Thank you. Thank you, Stephen.
We'll see you next month. That's Jill Belvin, the Belvin Insurance Agency. Hey, that's going to do it for us. We'll be back with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.